Hi, this is Dr. Janowski for Sonata. Today we're going to talk about filling the hands. And people often forget that this is a fantastic area to use filler. Just like faces, hands can be improved in terms of revolumizing. As we get older, we lose the volume in our hands. And resurfacing, get the brown spots out, get the skin tighter and smoother, so we can use lasers on hands, we can use IPL, we can use products, and we can use fillers. So it's one of those overlooked areas that, it's true, hands can show our age and we can do everything great here, and then we forget to also do the hands. Now, Galderma has just had an approval for the Restylane Lift, which is of course an old product, but now it's the first time it's an FDA approved product for filling the hands. We've been using products off-label, but now we can say it's an FDA approved indication. And so we're going to use Restylane Lift to fill in the hands, and I'm going to use a cannula technique, which is has much less discomfort than just using a needle. But there are different ways to put it in, and we'll see some instant volumization and rejuvenation of the hands. So we're going to do a filler injection of Restylane Lift in the hands, and I'm going to use some local anesthetic to numb just a few spots where the cannula is going to go in and deliver the product. So I like to use this little vibration tool when I inject, so we're just going to put a tiny bit of local anesthetic, and we're just going to put it in a couple of spots here. Maybe one more. That's all the patient really needs in terms of numbing or pre-numbing. So we've numbed her up, and now we're just going to use a cannula like we use for many areas of the face. And just like the face, it just slips gently underneath the skin, and the patient isn't going to feel very much. So I'll show you how that looks there. We'll just kind of do a little bit of this here. It's going to feel a little bit funny. And then we're just going to lay some stripes down and just kind of distribute that product all around, like that, in different directions. And we really shouldn't have bruising either with the cannula. It finds its way around the vessels, and we're just creating a little bit of cushion and volume under there. And then we'll massage it out to make sure it's even. Typically 1 syringe per hand is 1 to 2, with maybe an average of 2 to 3 syringes total. And so that's some of that product in there already, and we can see the volume already showing. Okay, so we just did one hand. Took me all of 5 minutes. Melanie was totally comfortable the whole time. Was there any pain with that?
No.
No. And so using the technique with cannula, I think it's just much easier. And we'll show you here just the done side versus the undone side. You can see already the improvement in volume and just overall smoothness there, and compared to the side that we haven't treated. And she could also benefit from some IPL just to remove the spots, so we'll do that too. So that's the hand filler injection using Restylane Lift, now FDA approved.